So what we're going to do now is we'll start with just me and Bruce talking, and then afterwards, once people ask questions, we open up for questions. You can put your videos back on, right, Deb?
Yes.
Okay, great. So I think we're live. Hi, it's Dr. Susan, and I am so glad that you are with us on the Ask Dr. Susan. We have a very special session tonight. We're doing it on a different day, and we're welcoming Dr. Bruce Y. Lee. How are you tonight, Bruce?
I'm good, Susan. Thanks for having me.
Great. Thank you so much for coming. And for those of you who've never been with me before, I welcome you. And I like to start with just a minute of centering. If that's okay with you, Bruce?
Mm-hmm.
So why don't we all just take a moment. You can close your eyes or not. Get yourself a little comfortable. You've had a long day. There's lots of distractions that are maybe going on right now. And just take a couple of deep breaths. In through your nose and out through your mouth. In through your nose and out through your mouth. So that we can center ourselves to really be here for the next hour together. And what I always like to do is to set an intention. So perhaps you can think about what you would like to get out of the next hour. Maybe it's to ask questions. Maybe it's to give information. Maybe it's just to have a reprieve from things that were going on earlier. Doing something a little bit different. Just being on Zoom. Whatever that is, we want to make that happen for you. So if you can put your intention, just put it out there in your mind. And maybe it's that you just want a new experience. And so just breathe. Just let all the other thoughts go. Okay, and when you're ready, you can come back, open your eyes. Okay. And now I'm so excited to have you on tonight because wait till you hear what Bruce's credentials are. For those of you that know him, that's why you're here. And for those of you that don't know him, Bruce is a writer, a journalist, a digital and computational health expert. He's a system modeler. He's a professor and entrepreneur. He's a professor at CUNY, and he's also a director of the public health systems there. And he's also a regular writer, as I mentioned before, but he's a regular writer for Forbes. And Bruce, what I also want to share is I know a little bit about your mission, and your mission is, quote, to help everyone better understand the complex systems of health and science. Well, I don't think, at least in my lifetime, there is no time where we have needed you more in terms of you have the opportunity to fulfill your mission, right? In terms of what's going on right now. So I think we can all agree on that. So what I'd like to start is, you get so many questions and you've written about so many topics right now with COVID-19. So what are you finding is the most challenging? And then I'm going to ask you some specific questions.
Mm-hmm. Well, one of the most challenging things is there's just so much information that's floating out there on social media, on the internet, or just talking to people. And it's tough for people to sort out right from wrong. Right. Because there's just so many voices out there. And one of the challenging things is that when you have a common enemy, which basically this pathogen is, this virus is a common enemy that's really spreading throughout so many different countries, not just this country, but other countries as well, it really requires a coordinated response. When you have an emergency, you can't be in a situation where, like, if a building's burning down, you can't be arguing with people. And you can't be saying, okay, is this really serious? Or, maybe this fire is a hoax, or, who caused this fire? All these voices, you really have to kind of get together and say, okay, how do we get ourselves out of this situation? And how do we tackle this common enemy? And when I say common, it's not just within this country, it's across the world. Like, how does the world work together to deal with this common enemy? And I think that's the biggest challenge, because it really requires that, because this is a very complex virus and it's causing a lot of complex problems. So if the response is very disjointed and uncoordinated, we're not going to be very effective at controlling the virus.
Right. And we know that at least it's my experience, and it's not happening right now, right? And we see a lot of contradictory information. And I think maybe let's start there, because I even know for myself, and I pride myself on being a pretty good consumer of media and have some media intelligence and knowing how to navigate. And even I'm confused about who do I believe? What do I read? What sources are the best? So what are you finding, given that there's so much disagreement? How should, including myself, how should people navigate through all of the information and know who to trust and know where to go for reliable information?
Mm-hmm. So that's another big challenge with this current pandemic. A lot of these things that are happening are not surprises. So there's a whole community of scientists and public health experts who over the past couple decades, and I'm part of the community, have been studying things like this. So, and then this is not the first time that we've had an infectious disease outbreak or epidemic. So we had a pandemic back in 2009. We've had the Zika outbreak. We've had the Ebola outbreak. There's a SARS outbreak back in 2002. And there are always these different infectious diseases that you may or may not hear about that are acting up and going up and down in terms of activity. So there's this whole body of science on how to deal with an epidemic or pandemic. And so one of the keys with this pandemic was, how can we execute or implement the knowledge that we already have? And the contradictory information that people are hearing is not from that community. It's not from the scientific community that studied these things for years and did, figured out things by trials, by studies, experiments, etc. It's coming from all these other sources, which I think is making things very confusing for people. You'll see during this pandemic, suddenly everyone has an opinion. You jump on social media, and so you have people in big caps saying, this is such and such, or throwing out some statistics, and you have to ask yourself, okay, wait, how long has this person really looked at this? Is this really scientific evidence, or is this someone who just decided to say something? And a large percentage of the voices out there are people who just decided to say something. And there's even talk about, is there misinformation being really pushed? There's talk about bots pushing information, and then there's a lot of political agendas that are out there, a lot of financial and business agendas, and that's the problem. Like, you ultimately have to stick to the science. The science has been relatively clear. There's been a few things where scientists have had to wait because this virus is a new virus, so you have to actually see how it behaves and figure out what's the specific of what's going on, but the strategy hasn't really changed that much. So I think one of the key things is to really look at, where is the information coming from? What type of scientific evidence is behind it? I'm sorry, go ahead, Susan.
No, I just want to underscore point number one, because I think you're saying the first thing for people to do is to question, who is the information coming from? How long has this person been in the position in terms of knowing the information and sharing the information? Because I think that's a really good point that we forget about, because when we see somebody that we might respect in one area, in this country, I think, and probably worldwide, I don't know, but when we have like a mentor or somebody that we look up to, we think everything then that they say is correct. And I think that especially now, that's so important that you can admire the person. They could be really expert at some things, but when it comes to science and the information about the history of pandemics, and that is true. And I want to underscore what you said, is to say, okay, how long has this person been in that arena, right? How long has that person been involved either in the actual field of science or has been reporting on science and being in that? So I wanted to just underscore, because I think that was, that's not talked about enough. And I think that, a lot, and I see it happening where, again, where people who might be admired for lots of different things are now looked to for certain information that's contradicting what the people who are really in it and have the expertise in it are saying. to continue. So I would say that's number one. If we were looking for real guidance and tips on how do I know what information to trust, the first thing is who's saying it and where are they getting it from?
Yep, absolutely.
Right.
And I think it also, you have to look at, what type of information is being provided. So it's one thing to, criticize or blame something or say, okay, this person's wrong, but like, what are you providing solutions, and are you providing evidence behind your proposed solutions? So some of these things are fairly straightforward. Like, for instance, it's a virus, and the virus spreads from person to person. And so if someone's saying, well, don't use separation in terms of physical distancing, we use the term social distancing, and when we say social distancing, we don't mean cut off communication with people, but by that we mean try to keep distance. And if someone's saying, oh no, we don't do that, well, it's still a virus, and it still will spread if there's physical contact. So unless you can provide an alternative to that, then you have to go with that. You have to go with that intervention. So really checking to see if people are walking you through the explanation and saying, this is the recommendation, or this is what needs to be done for these reasons. Here are the limitations, because I'm going to be very frank in terms of the limitations, but we still feel that you should do this based on this reason. And if you look, the people that have been studying this for a while, they'll say that, they'll say the limitations of what they're suggesting. Whereas some loud voices, you'll see, lots of exclamation marks, all caps, but there's no real acknowledgement that, okay, here's the limitations of what I'm saying, and this is why this is the rationale behind what we're explaining or what we're saying.
And I think what happens is, and we were talking about this the other night, there's, what we call confirmation bias, and people want to hear what they want to hear because, we want to be able to be physically together. And you know this, that I like to use the term physical distance as opposed to social, because socially it has a different thing, but we can leave that aside. But if we're talking about physical distance, nobody wants to be physical. It's like, okay, it's 10 weeks already. We're done. I'm ready to be physically close. And so when we hear someone saying, you and someone that we respect, right? It's okay. It looks like it's now okay to be together again. We want to hear that, I think the other piece is, being aware of, what's your preconceived desire and notion, and then are you going to be open? And it's not about being political. And I just want to say, I'm not looking at, it's not about a political orientation, and it's not about who's right or wrong. It's about the facts, right? But
absolutely,
putting the facts out differently, we have to be careful about, well, what if, it's almost like, what if that was right, that you did need to distance? Would you accept that? And for a lot of people right now, it's like, maybe the answer is no. And that's why people are listening to the contrary, or some people are so easy to just say okay to the non-science explanations or recommendations, because it's really hard to accept that you can't have people come into your home, perhaps,
Absolutely. Yes. Yeah, there has to be an understanding that, we're in a different situation. Things have changed. And so there needs to be a solution. And we have a problem, so there needs to be a solution. And the solution isn't just ignore the problem. There has to be some way of preventing this virus from spreading, and it's a real virus. So you're absolutely right that there can be this tendency to say, okay, I want things to return to normal as quickly as possible, and many people would like that. This is by no means easy. The situation is challenging, but the fact is that we as a country have faced other challenging situations in the past. Maybe people weren't around back then when there were other types of challenges, but fortunately and unfortunately, challenges such as infectious disease outbreaks are a fact of life. They're going to occur. You know, one of the key things, that the key points is that over the past 15 years or so, it's been repeated over and over again from the community that it's not about if the next pandemic occurs, it's when. This will not be the last pandemic. We're gonna see other pandemics in the future, and this certainly will not be the last infectious disease outbreak. So that's what happens. Over time, these things happen. That's the biology, that's the epidemiology of these different types of
First, just
diseases.
go back. When you say for the community, just clarify that, because I know what you mean, but I want you to clarify that, because you're talking about the community that has been involved for
Yes.
years. So
Yes.
can you talk about that community a little bit and then continue, because it was a little.
So that includes people. It includes a wide variety of folks. It includes people who are scientists who are studying these different types of pathogens in the laboratory. It includes scientists who are studying these pathogens in the field, and it includes people who are studying pathogens amongst humans and also animals. It includes public health officials, public health experts. It includes folks who are philanthropists, who are interested, you know, folks like Bill Gates, who have contributed funds and you know, supported a lot of this research. It's been very, very clear that these events in which viruses and different pathogens jump from animals to humans, and sometimes that'll occur and it's no big deal, but everyone gets a little bit concerned and they say, okay, we're fine. But then sometimes it happens and people get more concerned. And of course, there are situations like this where it becomes an even bigger problem. So this community, so this pandemic, epidemic preparedness community, and also includes security experts, because, you know, they and operations experts who have to help respond to a pandemic or epidemic, have predicted that this would happen, again, when it happens and not if it happens. And so that was the big question, you know, when is it going to happen? And there's been warnings. And the challenge is there hasn't been enough concern and enough support of being more prepared. So there was a lot of concern amongst this community, this preparedness community, because we were all very worried, like, okay, we can't keep waiting another year passed and nothing happened. Okay. So it's really a different perspective. Whereas if you look at, you know, the general public, maybe there wasn't this awareness. So this seems like a surprise. The virus comes and everyone's surprised. But where if you're been looking at this for the past decade or two, then this is not surprising. You just didn't know the exact timing and where it specifically will come from.
So why do you think that we weren't more open to that? Was it because of the timing and not knowing, or is it partly not wanting to know, not wanting to face difficult things? What do you think when you think about this? And I know you do a lot of thinking about this in many of your roles. What do you think?
Well, part of it is human nature. So human nature is to not deal with a problem until you're hit with it in the face. And so, you know, we always give the example of, okay, you know, you don't think about your health until you get chest pain, which lands you in the emergency room, or you get very sick. You're like, oh my goodness, I better start eating better, or I better start exercising. So that's sort of the teachable moment when you realize, oh my goodness, I need to take better care of myself. And we all do this. Okay, we're all in this situation where, you know, we push aside some type of preventative measure, whether it's a health measure, or maybe it's, you know, even like cleaning out the attic, or making sure you keep in touch with family and friends. Like all these different types of things we'll tend to neglect, because there's a whole tyranny of the quote unquote tyranny of the urgent, where you're more likely to address things which are more urgent. So we run throughout life addressing things that are more urgent. So really preparing for something is more of an investment. And it's hard from a human nature standpoint to do that. The second issue is it requires investment. It requires resources. So you have to convince people, like, you need to sink some money into creating infrastructure or creating a surveillance program that will look for these different types of viruses. And whereas people are arguing to put money elsewhere. And so you're really competing against a lot of different voices and saying, no, don't put that money here, put it over here, over here. And so it's a tougher argument. It's the same challenge that you face with vaccines, because vaccines are supposed to prevent something, and it doesn't take care of an immediate problem right then and there. So you don't see that problem. So sometimes it's tougher to invest in something.
Yeah. Yeah, and I think you're right in terms of we all experience that, right? You know, you might have a tooth that's kind of, causing a little bit of discomfort, or it's cracked and you have to get to it. But as soon as it causes a lot of pain or it falls out and it's clear, so something's not a problem until it's a huge problem in a sense.
Absolutely, yeah. And the other issue is it can seem a little removed, like when people are talking about these infectious diseases. How many people regularly go to the NIH website, for instance, just for leisure reading? Maybe some do. There's certain people in the scientific community that's leisure reading, and that's fun. But many people won't do that. Or you hear about a certain virus that's maybe in bats or some other animal, and you think, well, that's not really so relevant to my daily life or what I'm doing. But that's where these things come. So it's a complex system. So it's a set of different steps that occur. And again, as humans, we can find it challenging to think more than 1 or 2 steps ahead. For instance, if someone pushes you, you're like, okay, that person pushed me, but you don't look at like maybe 2 or 3 steps and like this could lead to this, which could lead to this. Okay. And that's what happens. There's a chain reaction, and eventually something like this occurs.
Okay, so now that we're here, right? Mm-hmm. That's a little bit about what we can do, and maybe hopefully we'll apply it to the future.
Yep.
But we're still in it right now.
Yeah.
And the other thing that I was thinking as you were talking about the whole it's not a problem until it's a problem is the experience that so many are having in terms of different experiences, right? Mm-hmm. You have people from all over the country on this call, and depending on where you are, you can even be in the same borough and have in the city and have different experiences in terms of what people should be doing and what the norm is and what behavior is. Mm-hmm. So what do you, I know that you've done a lot of writing about that and thinking about that. What's your current thoughts on how that's affecting different people?
Yeah, so I think that we can look at it both sides. So this pandemic certainly is differentially affecting different people and different populations and different social demographics. So you may have seen the news showing that there are some of the social demographics that are getting harder hit by this pandemic. And the main reason for that is when viruses spread, they mirror what's actually going on in society. Because for a virus, in order to spread, you have to have some type of contact with someone, either direct physical contact or maybe through, coughing or respiratory droplets, or you touch the same thing. So you see situations where, a person's type of work and their social structures and their interactions will determine their risk for catching the virus. So certainly people who are essential workers, who still have to continue to go to work and can't just cut themselves off from other folks, are at higher risk. Healthcare workers and people who are maintaining a lot of the businesses that we all depend on. I mean, that's why they're essential. We need them. So, but that puts them at greater risk. And then social distancing may be easier for some. Certainly, if you have a house and you can stay in the house, that's okay. But there are many people that don't have that luxury. They go back and they live in a very crowded neighborhood, or they have to go to work because it depends. Their paycheck depends on that. And then also, we saw in New York City. New York City has a denser population. There are more interactions. So what you're really seeing is a heterogeneous effect, and the virus itself doesn't discriminate. The virus doesn't say, oh, I'm going to go after that person and not that person. The virus just basically relies on contact. But what you're seeing is a lot of these disparities and differences in people's situations being uncovered by the virus, so there's definitely that differential effect. So that's on the one side. So you're actually seeing the virus spread heterogeneously. On the flip side, you see very different reactions amongst folks, and that's for a variety of reasons. So one is, you mentioned previously, there's all sorts of information out there. So different people are listening to different things, and as you mentioned, confirmation bias is there. So people originally go in initially with their biases, and they just look for information that will support that. So you see people handling the pandemic very differently. Also, there's communications issues, and not everyone is being reached. And also, we have to keep in mind that people have different trust levels with different people who are communicating information. If you see someone that looks like you, that can relate to you, you're more likely to listen to that person. If you see someone that you feel like, oh, that person can't relate to me, that person doesn't understand my situation, you may be less likely to listen to that person. So we're dealing with all these different forces, and that's why you go out and you see people handling things very differently. And of course, psychologically, there are people who are more or less accepting of what they're hearing or the situation, or they may be more willing to adapt to different situations. So it's very complex.
Yeah, and another piece that was brought up last week by Joel was this notion of the sleeper effect, right? That people hear of something and that kind of stays, but they don't know where they got it from. And so once a piece of information kind of catches on, it's like that it could be a piece of misinformation, but you forget even where you heard it, and it's like if you ask somebody, well, really, where did you hear that from? They might not know.
Absolutely, yeah. So, I mean, we there are all these behavioral and psychological challenges in a situation where you're trying to process information.
Right.
And we hear about all these heuristic biases as well, right? You're more likely to hear something that's more salient. You're more likely to listen to something that's maybe more recent or maybe earlier on in the situation. So everyone has their own biases. So you have to remember, and you actually have to make an effort to try to say, nope, okay, let's just recognize your own biases, recognize what you're more susceptible to when it comes to taking in information, and then put that aside on the table and say, okay, I want to be open and I want to evaluate things for its own merit. And that requires extra effort, and it's especially challenging when it's an emergency.
I know that a lot of people have specific questions, which we'll get to, the everyday, like, can I reuse a mask and all that. We're going to get to that. But I just want to ask a couple of other questions. One of the things that I'm finding is people aren't trusting even reliable sources or historically reliable sources, because it sounds like the recommendation rather is changing. I remember when the first week before New York and we even shut down, that, the CDC came out and said, you don't need to wear a mask. Then the next week, you need to wear a mask. And then it becomes, well, it's not protecting you. It's only protecting the other person. And now it might be protecting you. And so what happens is when you have, and another thing that happened recently is a change on the medication to use, right? So for a long time, the research was saying, and the CDC was saying, this is not recommended. And then suddenly, because certain leaders were using the medication, it then softened the recommendations, right? And then it became, no, just check it with your doctor. So how do you even continue to trust those institutions that we are supposed to trust when they're constantly changing?
Yeah, I think with those two examples that you mentioned, so the mask issue has been interesting because certainly on the surface, it looks like things have changed back and forth. But this is an example where the messaging wasn't clear, and it also was not, it was muddled by other information. So the mask recommendation hasn't really changed that much. So it's always been the situation where, so you have several different masks. So you have the N95 masks, and these are masks which basically healthcare workers, you see healthcare workers wear them, and they're supposed to filter out the virus. They're called N95 because at its worst, like if you were to graph the size of the particles, some particles are easier to filter out, like big ones. So, naturally, if like something like a football comes after you, it's going to, block it or what have you, or if something is very small, but like you run into challenges between 0.1 and 0.3 microns, but even that, it filters out at least 95%. That's why it's called an N95 mask. So those are supposed to protect you and potentially protect other people. Those are the things very early on, you know, CDC and other folks said, don't wear these, you know, if you're just in the public and you're not a healthcare worker, don't wear these. And the reason for that recommendation was that, number one, there's a shortage of masks. And two is, to wear those masks, you have to be fit. They actually have to fit you. And there are all these guidelines, like those masks become less effective over time. You're actually not supposed to wear them more than 3 to 5 times. And so the concern was that people would be using these and when it was in short supply, but also they'd be using them improperly. If you actually use them improperly, you can infect yourself because it's a filter.
So I want to underscore something. The N95, a true N95,
yes,
initially was, don't use it because there's a shortage, but the N95 is used with healthcare workers, and that is the mask that, if worn correctly, can protect the wearer from,
yes,
it protects both. It protects the wearer and others, correct?
exactly. Yep, exactly. So that's the reason why people said, you know, don't wear these masks. They specifically were talking about the N95. And then with the other masks, people were saying, if you're trying to protect yourself, they're not going to be useful. Like the surgical masks, the ones that aren't in the N95 or bandana and those things, like it's not going to protect you. That hasn't changed because the virus particles are too small and they're going to be able to get through the holes.
So why are we putting more energy into, because there's so many non-N95 masks that seem to be coming out. I mean, I know they're easier to make, but why, if we're so concerned about the spread, why not increase the manufacturing of N95 for everyone?
Yeah, so that was an issue. People were saying, well, why not massively increase the supply? And that was a push for the federal government to really enact the Defense Production Act and say, okay, produce, but for a variety of reasons that didn't happen. And the other problem is that it is hard to ramp up so quickly because if there weren't even enough masks for healthcare workers. Imagine trying to cover the entire population. So they did try to ramp up. You're right. I mean, if enough people in the population had those masks, and I want to add, and were trained properly on how to use them, then that would be even better. But that just wasn't the situation, and that still isn't the situation. So that recommendation has not changed. And the fact that wearing the other types of masks doesn't protect you, that hasn't changed. The only thing that has changed is saying, okay, people have said you can always cover your face if you want to, but now it's being recommended or suggested. And the reason for that change is studies have found that the virus appears to be more contagious than people realize. In other words, the spray through the air is more significant, and that took time to figure out. So that required studies. So the initial assumption was that this virus is going to be similar to other respiratory viruses like the flu and other types of coronaviruses, but this virus is turning out to be different. So that's the one thing that's evolved, but it's not a massive change. It's just now it's being encouraged because they realize, okay, well, if you're just like breathing out the virus droplets, it's probably better to cover your face so that you can protect other people. So that's the one thing that's evolved.
Okay. And then with the medication, with the hydrochloroquine, that seems to have in the last week changed slightly. That prior it was, from my understanding, and please clarify this, is that it was being researched and being studied to see if it could be used as a cure. Then it was talked about as a preventive measure, and from what I understood, it was not to be used as preventive, and that what they found in a lot of the studies was that it actually could be hurtful and have, some unwanted consequences. And then the study said, don't use it even as a cure or to slow down. But then we had certain people that are using it that are in leadership positions who that came out. And then I noticed that on the CDC website, it kind of shifted this week to, it used to be the recommendation, and please, you clarify this, the recommendation was to not use it, and now it's check with your doctor. That your individual physician should be the one to be making those recommendations for you. So what's the truth on that? Break on that. Yeah, please.
So this is an unfortunate situation where a lot of this has been politicized, and from a scientific standpoint, so those who are in the scientific community haven't really changed their opinion of this. So what happened was there were some initial case studies. So if you recall, early on in the pandemic, different people were trying different things because this was a completely new pathogen. And so you would have researchers and doctors just trying different medications to see if it would have an effect. And then there were some case reports that came out of France that suggested that it could reduce the length of illness, the duration of symptoms and things like that. But when that first came out, the majority of the scientific community said, okay, these are case reports, okay? And when case reports come out, like, you don't know what else happened, because case reports aren't formal clinical studies. They don't control the studies with placebos and make sure everything's matched up. It's just you get a bunch of people and they happen to get the medication, and it seems like some of them happen to have shorter lengths of illnesses. So, but we don't know what could have caused that. So if you look at the chatter in the scientific community, most folks said, okay, this doesn't mean anything, but it's worthwhile continuing to study it. But the trouble is, once that came out, you suddenly got all this noise saying that, this may be a treatment. And that was very premature. It was fairly irresponsible to say from that data that this is a potential treatment. So if you paid attention, if people paid attention to the folks that were in the know, to my knowledge, none of them said, oh, this is a treatment. The key was trying to control that chatter that was saying all these other things and really confusing the general public. The same thing is true with it being a preventive measure. That never came out of the scientific community that it should be a preventive measure. That's actually one of the reasons why the NIH established a website called the COVID-19 treatment guidelines. So if you Google it and make sure it's the NIH website, nih.gov, what they did was they pulled together a number of scientific experts who revealed evidence, and they're updating that regularly. So it's a live document. And that's where you can see, is there evidence behind each of these different treatments? So if you really want to figure out what's going on, go there, because it lists all the experts, so you can clearly see who the experts are. And at no point did they say, oh, this might be, there's evidence that this is a treatment or a preventive measure. That has not changed. So again, that's an example of where the scientists have been fairly consistent, but it's really this other noise that's really made things confusing for the public, I think.
That's great. Thanks for clarifying that and giving us that site to really look at. So before I open it up to questions, and I have some specific that I know people want to know. Now that different parts of the country are doing different things, for right now, what you're seeing, what would be the top 3 things that you would want people to know? Like, here's your chance. I know, this is what you want to do. You want to get the information out there. What do you want to tell people? What do you want people to know?
Well, one general thing is this requires a coordinated response. So you can view this as a football game, if you're talking about American football, or a football match, or a basketball game, or what have you. Think about it this way. If you were to have people running in all different directions during a football match or football game, what are the chances that you would be able to take on the opponent? I mean, maybe you'd be able to defeat the opponent, but it'd be a lot harder. So when we have things all over the place and people aren't coordinating, et cetera, it makes things more difficult. It's the same
But,
thing with the.
but Bruce, I don't want to interrupt you, but that's great for the governors, the mayors, right? So, but and that's a whole different call, and maybe we can do that with them. But for individual folks, for people that are on this call, for the people that are watching, most of us are not in the position to coordinate. The only people we can coordinate is ourselves and the people in our families. Other than, so what would you recommend for us, for the people out there that are watching, for the people on this call?
So it applies individually as well, because we have to remember that everything that we do affects other people, and everything that other people do affects us. And there's a tendency to think that we're on these islands and that we control everything that we do, and that maybe we don't depend on the person that's far out of sight or in another neighborhood or another situation. But this pandemic shows that we are, for better or for worse, and I'd argue in general for better, but sometimes for worse, are intricately connected. We affect each other, what we're doing. So this applies to everything, economically, behaviorally, socially, etc. So when we do when we take different actions, our actions have consequences, and they affect, and you never know when those consequences will actually come back to bite you in the backside. Right? Or
what would you recommend? So right now, starting this very moment, if you could tell us what to do, and we said, all right, Bruce, we're going to listen to you. What should we do in the next little while? What are certain specific behaviors that you would want us to follow?
So we have to continue the social distance. And so even though things are reopening, you should still keep in mind the scientific principles that if people can connect with each other, physically, you may spread the virus. If you aren't very careful about, washing your hands and disinfecting, or if you touch mutual things. So just because things are reopening does not mean return absolutely to normal, or normal in quotes, basically return to what things were like pre-pandemic.
And there's been some confusion with the amount of physical distance. So I'm going to put it a little bit further. Is it 6 feet? Is it 10 feet? When we say physically distant, how far should we be staying from people?
So the recommendation has been 6 feet. Now that's a minimum. So if you can stay further, great. I mean, it's not as if there's suddenly like a wall of force that comes down at 6 feet, right? It's not. It's actually everything. Every border is a gradual thing. So 6 feet is an easy thing to remember. I like to say, just think of someone that's 6 feet tall, and then imagine that person lying down like between you and someone else. So that's easy to remember. But there are some studies which suggest that respiratory droplets can carry further. So and also gets complicated because maybe 6 feet, maybe if someone's just breathing normally, but what happens if someone's running and panting or something of that sort? So 6 feet means, okay, at least 6 feet, but try to keep as much distance as possible, physical distance. So some people are suggesting, it's better to do 12 feet. And it doesn't mean if you're like, oh my goodness, I was within 11 feet for a second, cats and dogs will fall from the sky and, everything will be a disaster. No, I mean, it's all relative. But I would say try to keep as much distance as you can within reason, but certainly more than 6 feet.
So one is the physical distancing, 6 feet. Okay. One is the wearing masks, right? Yeah,
it's because again, you're protecting other people from you, and you don't know unless you're taking a test constantly and get the results immediately. You don't know when you may become infectious. Even if you had a negative test yesterday, you may become infectious today. So
right? I'm sorry. Hand washing, you mentioned?
Hand washing is so important, yes. We are terrible at hand washing. There was a study in which they put like this, invisible ink on people, and had them wash hands, and then had them touch their face, and then like all the ink ended up on people's faces. So we're really bad at that. So people hear about sing the birthday song, or count to 20. If you don't want to sing the birthday song, there's plenty of other songs that I can offer to that you can sing. In fact, if you Google it, there's like songs. If you say songs that I can sing other than Happy Birthday,
To wash your hands.
you'll get lots of other options. So yeah, we have wash your hands and do it like back of the hands, in between the hands. Do it very diligently.
That's great. And I think we're getting a lot of questions. So this has been fantastic. I'll do some other closing words, but let's just take people's questions now, because I think people are really wanting to ask you specific questions. Okay, so do you want, I'm going to read these questions. One is, so Joel is asking, will we ever get back to normal? And well, I would say, what does normal mean? But what does that actually mean? So what are your thoughts on, how is the future going to be? Is it changed forever?
Yeah, so it all depends on your definition of normal. Whenever you go through things like this, things change. If you look back in their history, whenever our country has gone through certain disasters, things never really return to what they were before. They changed. Certainly after 9/11, airport security changed, how you fly changed. The TSA was started, all these different things. Now, that doesn't mean necessarily the future will be worse, but things will change. Now, when people ask that, I'm assuming they mean more like, okay, will we be able to interact with people, or will we be able to get close physically? And that's going to happen. Yeah, eventually. The question is when. Because throughout history there has been these infectious disease outbreaks and epidemics and pandemics, and humans have survived them and have thrived after them. So I want to put a positive spin on the pandemic, because this is actually a real opportunity to see what our underlying problems were as a society. So whenever you have a disaster, there's the negative, pessimistic side. It's like, okay, there's all these problems, and certainly, yeah, I don't want to downplay. There's been major problems. We've suffered people's deaths, people suffering. That's terrible stuff, and people losing jobs, etc. But the positive side of disasters is it forces us to say, okay, what are the problems that we need to deal with? What do we need to change? What do we need to improve? So I think there will be opportunity to improve things. And yeah, in terms of actually returning to situations where people are interacting with each other, shaking hands or fist bumping and all those things like that, that will come eventually.
You think that we'll be shaking hands again?
Well, I mean, some people will be shaking hands. There's some people have argued that shaking hands is a rather archaic thing to do, that we don't need to do that. There's all these different things that you can do instead. You can do you can do a shimmy to each other, or you can elbow bump, or do a dance, or do the electric slide, or what have you. So maybe we can get creative with that. I mean, we aren't really wed to shaking hands.
Right, and there's lots of cultures that never shook hands. I mean,
absolutely, yeah.
There's
bowing.
There's a lot
yep.
of, yeah. So I just want to say you can unmute if you have a question, and I'm also going to ask the question from Sam. Sam asks, would a homemade mask made from tightly woven cotton and layers of chiffon and or silk provide any amount of protection for the wearer?
So that's challenging, because if N95 masks, the official N95 masks has a number of different construction properties that protect you. So one is you have this very tortuous, they have these fibers which create a very tortuous route for a virus to have to travel through. So physically the virus gets kind of caught in this. And it also creates this Brownian motion where you have very small particles that just kind of bump into the fibers and never really get through the mask. But an additional thing is these masks are carrying an electric charge. So they actually charge the masks so that it makes it tougher for particles to get through, because they actually stick electrically to the fibers. So you have all those levels of defense that other materials don't have. And the problem is, okay, so you could wear like a concrete block around your face, one problem, you wouldn't be able to breathe and you pass out, right? So these N95 masks are built in a way that you can actually still breathe. It is tougher to breathe when you wear them, but it keeps things from getting in. Those other types of constructions, either they get too thick so that you can't breathe, which is a problem, or they can let things through. So that's why you actually have to use something which uses that type of construction, or at least has been tested and certified as N95.
That's great. Okay, so does that, and I think that, Sam, does that answer your question? You can either unmute yourself or put it in the chat. Okay, you can unmute yourself if you have a question. Please do. Please, we welcome question from Emily. Oh, so Emily, that's Tom. So Tom is on the Emily. So you can unmute yourself, I believe, Tom. And you can also show, you can put your video on so we can see you as well, and you can ask your question.
Okay, yeah, let me do that. I guess any advice, Bruce, first of all, thank you very much for sharing all that you know and being someone that we can all trust, at least as much as we know. You're very credible, and it's nice to be able to listen to just pure, thoughtful science. Any thoughts you would tell us in terms of, I call it, warnings and advice about maintaining health and minimizing stress, even if we're not directly affected by COVID, because it's difficult on just about everyone?
Mm-hmm. Yeah, certainly all those healthy habits that are suggested or recommended during a non-pandemic times, we have to maintain. It's very easy to not maintain a healthy diet and exercise. Exercise is a challenge, right? Because your physical activity options are more limited, especially if you're used to playing team sports or you're used to going to a gym. So those things are important. So being able to maintain those, either maintain those routines or find replacements are very important. And then, you talk about other types of health maintenance. So other medical problems don't go away during pandemic. They don't take a vacation. They are still there. So we're still going to have to deal with chronic medical conditions. We're also going to have to deal with other infectious diseases because they're going to crop up as well. And the challenge is that many of the healthcare facilities are closing off their routine care stuff. They are reopening now, but they've closed off the routine care. So there's been studies which have shown that childhood vaccinations have gone down during this pandemic, or people are there's another study that showed the number of visits due to heart problems have gone down. And the concern is that's not because the heart problems have gone away, it's because people just aren't going to the healthcare facilities. So try to maintain those your health in that way. Try to stay in contact with your doctor or your healthcare professionals. And then of course there's also that stress where you may feel cooped in, or you can't do the things that you normally will help relieve stress, like social interactions. So you want to try to replace some of those social interactions that you normally have with other types of interactions, Zoom calls, or I know it's not the same. Zoom is just not the same, but trying to replicate those as much as possible. So thinking about, one of the things that this pandemic does is it forces us to boil down, like, what do we really need? So like when you're going to the happy hour, why did you go to the happy hour? Was it because you really want to eat those fries, or was it because that was your opportunity to talk to someone else and kind of lay your problems down on the table so that other people could listen? Well, if it's the latter, then you can find other ways to do that. So you should go through a personal inventory and say, okay, what is really actually causing my stress? What relieved it before? And not like specifically like the actual general activity, but what specifically within those things help relieve my stress. And then therefore you can try to replicate those as much as possible. The other thing is, we have to stay optimistic, because ultimately, I'm hearing some of the opposite as well. Like people are saying that, this, society will end as we know it. No, it's not going to end as we know it. This is a serious virus, but it's not going to end society. We'll get through this. And so there are positive things to take home as well.
Thank you.
Thanks for that question, Tom. And just in terms of related to team sports, when do you think that will come back. There was a question about that, team sports, like for kids,
Yep.
And adults, but particularly for kids.
Yeah, so I've actually been part of something called Project Play 2020, and now we're actually having an iteration beyond 2020. And one of the goals of that consortium, and it's included all the major sports leagues like the NBA, Major League Baseball, U.S. Olympic Committee, et cetera, was to try to increase sports participation among kids, because we also have a physical inactivity problem throughout our country and an obesity epidemic. But since the pandemic started, one of the pivots has been, how do you resume play? So I can mention some of the things, but like if you want to get more details, you can Google Project Play, and it was initially organized by the Aspen Institute, and they have suggestions on how to get back into play, how to do safe play. So the key thing is to, how do you resume sports while maintaining social distancing and while disinfecting things and like equipment and any type of balls you may be using, et cetera. So they have advice in terms of how to stay fit and how you can participate in activities that are still reasonably physically distant from each other. Like, so for instance, if you play basketball, of course you can start playing by yourself. The NBA, there's something called the NBA Together initiative, which they have NBA stars on social media, and they show you different drills, like dribbling drills and things like that. So I would start with that, and then it will all depend, and this is why people are pushing testing, because you really want to know what the virus is doing around your neighborhood, around your region. So it could be, if we get a better idea of where the virus is traveling, where it's spreading, there might be certain neighborhoods in certain regions where we say, okay, the risk is lower, then potentially you can resume more and more of those sports activities, for instance. And as soon as you identify someone who might be positive, you can quickly try to isolate the person and isolate their contacts. So that's why testing is so important, because otherwise, to use a sports analogy, we're playing on the football field, but we can't see the field and we can't see the opponent.
It's interesting because this morning I actually live in an area in Brooklyn where I'm right at the tip of being in one of the highest top 10 zip codes where the virus is the most. Mm-hmm. And I went to the boardwalk early this morning, and there's a handball paddleball court, and I watched this incredible thing. So it was very early. It was like 7:00 in the morning, mm-hmm. and there were people that were playing, no masks, and a guy came, and the courts are actually closed, so they had to jump over the fence to get there. And it's a serious handball court. It's like where they have the nationals and stuff. Yeah. So I watched a guy come over the fence. He was masked. And as soon as he got with his guys, he took the mask off and then was going to play this very close game where, spit comes out very close, and he took the mask off. And I thought, what is wrong with this picture? Like, unless everybody was just tested, like before they entered this gate, and it was very scary. And I guess this leads into another question: how, if you're in a place that's semi-high populated, mm-hmm. and it's not like you're in an area that's kind of high risk, there's some, how is it safe to walk or safe to run? Like, what do you recommend for that?
The same principle. So you have to see if you can maintain that physical distance from folks. So in the same situation in terms of making sure you clean your hands frequently and avoid high touch objects. And if you touch them, you should try to disinfect the high touch objects. The other thing is, and you alluded to it, Susan, when people are breathing more heavily, that may be greater concern in terms of respiratory droplets coming out. So you want to exaggerate the distancing. And then there is some concern that, okay, if someone like breathed heavily somewhere or like panted or coughed or something like that the droplets can float in the air for a little bit. So if you want to be safe, don't immediately walk right into the route that someone was just at. So you want to so I would view this more as, say you're on a football field, you want to sort of don't do, obviously you don't want to walk down the street kind of dodging and things like that. But be strategic. You know, you survey the field and see where people are, and also you can signal to each other.
And, you know, I think that we have to just acknowledge, at least I had to do this for myself. And, you know, we talk about stress and the psychological and emotional factors that it has on us just in terms of functioning, but then also our entire system is, you know, it's so sad, right, that we now have to fear each other. Like just going on my walk this morning, I had to like, you know, I did have to duck and to look out and to be more vigilant, but it's like we have to be even more, you know, the whole point was like loving each other and being more, my mission was always to spread more kindness throughout the world. And now, like this morning on my walk, I thought, how am I going to, you know, how do I do that when I also, I'm saying I can't go near you, you know, for both myself and for you. And people not wearing the masks and then not knowing. So it's just kind of acknowledging that, I think, is important, just to say, you know, this is what works. This is what I experienced this morning. And just to say, okay, that's there. And how else can I deal with this? You know?
Yeah.
So,
On the positive side, you know, I've seen situations, and I've also experienced myself, where you go outside and then you coordinate with people. There's almost like this communication. It's like, okay, I got you. You know, you got eye contact.
Bruce, I need to be where you are, because unfortunately, I'm not seeing that as much where I'm walking. I live in an apartment, and in the building, people have been respectful on the rare occasion when I do go down in the elevator.
Yeah.
But I also make it known, no, you're not getting in here. So, you know, in that way we are. But I think it's the area, right?
Yeah, you know, I think one of the things that and we had actually talked about this, and when I say we, it's this preparedness community, this epidemic, pandemic preparedness community. A decade ago, I remember a conversation is that, okay, and this was with folks at the NIH who say, okay, we know that if you have to implement social distancing, it's not going to be easy. It's going to be difficult. So part of the planning was like, how do you make it easier for folks? And how do you come up with counter strategies that will make this easier for people to take and deal with this new normal, at least for a little while. And that's one of the things that, you know, we really needed and continue to need. You can't just say, okay, social distance and don't do this, you know, stop life as you've known it. And people need like strategies. They need to say, okay, now that we have to do this, we're gonna offer this service where you can do such and such, or, you know, here is an example of how you can spread awareness, or here's an example where you go down on the street, you can, instead of looking like you're dodging with people, make it more like a dance, and you say, okay, I got you, you know, I'm gonna move over here, you move over here, and then there's that kind of implicit communication. It can actually be quote unquote fun in different ways.
Well, you know what I love about that is it's looking for the yes as opposed to the no.
Yeah.
Right? We do that with kids all the time. I always say, don't say no, say yes tomorrow, or yes, you can do that, but then say when. So that's what it reminds me of. It's like we have to, it's a great point, focus on what we can do instead of, you know, flipping that. That's great. A couple of more questions. You can, I see it's in the chat, but please feel free to unmute and show yourself. Would being in close distance to people and touching, come back if and when we have a widespread vaccine related to vaccines? Well, actually, added to that, where does it actually look in terms of the reality of vaccines in the science community?
So in terms of vaccines, you know, this is the timelines that are being suggested right now are very, very aggressive timelines. So vaccines typically take a long time to develop. You know, we're talking about like 5 years or more, 5 to 8 years typically to take a vaccine all the way to the market. And we also do know that there's many pathogens where vaccines have been have people tried to develop vaccines for those pathogens and haven't been able to. So it's not a foregone conclusion that we'll have a vaccine. And also, you know, the aggressive timeline that people were talking about was 12 to 18 months. Now we're hearing, by the end of the year. That would be really very, very aggressive and unprecedented to really get it out there. So,
and do you think that's possible though? When you say it's aggressive, do you think that that's possible based on all of the information that you're hearing, the reliable information?
A lot of things have to cut the right way for that to happen, and we have to get very lucky with certain things because I was talking to a reporter just the other day, and we were talking about how even to run these clinical studies takes a while. Some people have estimated it takes 6 months to run a clinical study, because what you're doing is you're essentially giving the vaccine to people and waiting for them to be exposed. Like, you don't want to deliberately expose them to the virus. So that takes a while to kind of track that population. So I think sometime next year would be aggressive. I'm optimistic that might be doable, because again, the aggressive timeline was 12 to 18 months until some of the recent chatter. And the other thing we have to keep in mind is the vaccine is not going to be perfect. So one of the questions is, how much will the vaccine actually protect you? So for instance, the measles vaccine is fantastic. The measles vaccine is over 90% efficacy, meaning that if you're exposed to the virus, there is less than a 10% chance that you'll actually catch the virus. Whereas the flu vaccine, a lot lower. So, and in some years it can be as low as 30%, depending on the matching of the strain. So we have to remember that there may not be a perfect vaccine that will come out as well. So, but other things may happen. I mean, you may put in these contact tracing programs where you'll be able to catch the folks before they can infect other folks. And also, of course, as time goes on, more people will get infected. The pandemic will not last forever. So the answer.
Well, I want to underscore that. Hold on. That was a highlight. That's a great point, everybody. The pandemic will not last forever.
Mm-hmm.
There's a light at the end of the tunnel. There is hope. It's going to come to an end. Yes, good.
Absolutely.
I just like that, because that gets lost a little bit sometimes in all the reality of the negativity. But it will change. Yeah.
Yep. No, it's absolutely going to end at some point. It's not going to end overnight. It's not going to just, quote unquote, disappear. But it will eventually end. Now, just the question is, are there other things? Are there certain things like a vaccine that can accelerate that? In other words, try to end it earlier. And we'll have to see. I think a lot goes into developing a vaccine. We have to make sure that the vaccine is safe, that it doesn't cause side effects, and it actually is protective of folks. I know that there was some data that was, leaked or released on some of the early trials. Not enough patients and not enough information. We have to remember the first set of trials of a vaccine is just to test dosing and safety. So if you see these initial results from these initial trials coming out, it's just to test dosing and safety. It's not enough to prove whether it's protective or not. But what you'll probably see in the coming months is you might see some data come out. Just don't go up and down with this. Don't say, oh my goodness, all this data sounds like it's a great vaccine. Be even keeled. Remember, phase 1 studies is just dosing and safety.
I've heard that, and I sometimes think about this too,
Mm-hmm.
given in the political climate that we're in, and some of the forces that really want this to be done soon. We all want it to be sooner rather than later. That goes without saying. But some people in the science community are more realistic in terms of, let's make sure we get it right, right enough before we put it out there. And there's another camp of, let's just do it and hope that we're getting it right. And we want, I think, some people like myself are concerned that we may end up, because we want this, that we might do it sooner and then it may backfire. And what are your thoughts about that? And do you sometimes worry about that?
Yeah, I mean, this is another area that's been well studied for many years. I mean, there's a procedure that you have to go through to test vaccines, to develop vaccines and to test vaccines. And we don't want to take shortcuts, and because there's a reason why these procedures are in place. And there's a reason why you have to do a full study to really test whether a vaccine works. And if we make shortcuts, we're going to pay in the long run, or maybe even in the short run. So we've seen, one example has already occurred where, now there's all these like tests on the market, these COVID-19 tests and these serology tests, because there is emergency use, which basically say, okay, let's try to accelerate these onto the market. And that's helpful, but we also have to keep in mind that a lot of these tests, as a result, vary significantly in accuracy. So if you go get a test, you should check the accuracy of the test. You should check the sensitivity and specificity, try to get information. Well, first thing you should do is, before you get a test, you should ask, is this an FDA authorized test? Or are you giving me a bogus test? And then you should try to figure out, how accurate is this test? What's the sensitivity?
Will people give people the information? Like if they're going to a local urgent care or a truck, a mobile, will those places have the information to give you?
They should, because every test should have some type of insert, a packaging material. So be suspicious if you go somewhere and they get like kind of defensive or don't tell you, because there are a lot of scams out there that are occurring. So you don't want to be in a situation where people get very cagey and they don't really tell you information. So like if something's a formal setup, they should be able to tell you, look, yeah, this is the such and such test. This is the test from this manufacturer by this manufacturer. And, if you want to see the insert, here's the insert. It's just like if you go to a pharmacy and you get a medication, you get the insert, right? You get the information there. So buyer beware. So you need to be a smart shopper at all times, and get as much information as possible, because you could get a false negative or false positive. Even if the test is good, you can get false negative, false positive. So the same thing with a vaccine. We want to make sure that we go through the proper steps, because you've heard of the expression, 2 steps forward, like bunch of leaps backwards. We don't want to be in that situation, and we need to be even keel. Like we can't get too high, and we can't get too low. Like don't get too pessimistic, but don't get too blithely optimistic without data. You want to stay even keel in an emergency and stay calm and move forward. That's the way to approach it.
Bruce, I don't know if you can talk on this, so if you can, great. If not, it's okay. Especially in New York, now there's data that's coming out. We're finding the cases with children and adolescents that there may be, there have been some illnesses that now they believe are linked to that, and it's twofold. It's both, of course, parents really are worried about their own children, but also as a full community, it really affects schools, teachers. There's going to be school in the fall. So do you know much about the reliable information on what is happening with that and what we know and what we're looking at?
Yeah, so so this is the challenge of a completely novel pathogen. So a new virus like this, your immune system is, for lack of a better word, a virgin when it comes to this virus. Like it's never seen this before. So the immune system, first of all, doesn't recognize very early on that it's being invaded by this virus. And then once it recognizes it, it doesn't know what to do. It's trying all kinds of stuff. And, that's why the symptoms are all over the place. And what can happen is, so there's several ways that COVID-19 can turn bad. So one is when it goes down to your lower respiratory tract and starts infecting your lungs, and you develop a pneumonia, and then you may develop something called ARDS, which is just a very diffuse damage to your lungs, and then you go to respiratory failure and you need a ventilator. And so that's one way you can die from COVID-19 or suffer significantly. Another way is when you go through your immune system overreacts, and then there's something called a cytokine storm that occurs. So your immune system starts showering all kinds of chemicals and sending different types of cells, and it can actually damage the body itself as a result. And then there's all these intermediates. And so we're seeing things like potentially like blood clots can form, or potentially can affect your arteries and things like that. So, what's happening with kids, is a manifestation of these strange things that are happening to your body because your body doesn't know how to respond to it. So these case reports are serious and they're real. People are still trying to figure out, what's the pathway that creates these issues. But yeah, you're hearing stories about people developing blood clots or developing problems with their arteries, etc. So it's not unexpected because that's the problem with very new viruses. Your body just does not know how to respond to them.
And so what's the time frame for this in terms of, we're first starting to see these cases, so I think it's a little bit longer. So what is the community saying about that in terms of watching it? Should we be expecting more cases? How long? We say, like, for instance, there's about 2 weeks if you come in contact with someone that maybe have the virus, but for adults, right? Like 2 weeks or so before you might see a symptom. And we're saying, okay, if nothing happens in 14 days, then you're pretty clear. Or if you test negative in 14 days, but what are we looking at for children?
So the incubation period seems to range from 2 days to 14 days, with the average or the median somewhere in between, maybe like 6 days or somewhere between 5 to 7 days on average. So that's the time from infection to symptoms. That's tough to guess because you have to go back and guess when you actually were infected. So some cases it's obvious, you had a roommate and then later you became infected. So that's a little more obvious, but you don't actually know when that happened. So that's why you see these estimates may vary. And that's why I would be careful about hanging your hat on these specific estimates because they're simply based on studies of case histories. So they look back and they try to guess when did that actual infection occur. And you can imagine that if you got infected just somewhere and you don't know who infected you, you don't really know when that actually happened. Even if you're living with someone, you don't know when the actual infection point occurred. So that's one of the reasons why people say you still have to continue to be careful because you don't know. And you can't really necessarily say, okay, I'm in the clear. The recommendation of quarantine from the CDC has been 2 weeks because of that incubation period. There has been cases or suggestions that it could be longer. If you want to be safe, you might want to extend that to 3 weeks because there's been some studies that suggest that people will become infectious, beyond 14 days after the point of infection. So if you want to be safe, make it 21 days. But back to your original question. So what's happening essentially is this is how science is proceeding. First, there are case reports. So you hear of things and you might hear like, oh, okay, 1 or 2 or 5 or 10 or what have you showed a certain type of symptom or a certain type of problem. Okay, so that tells you that, okay, it looks like this may be associated with the infection. Then the next step is to do a more rigorous study where you're trying, you're getting enough people so that you can compare and see, is this really actually due to the virus infection or is this something that just happened to happen with the folks? And that takes time, right? You need to have enough of the cases happen over time to see that. So some of these situations, like some of the eye findings, like some of the blood clots, the COVID toe, some of the skin things, a lot of them are still case reports. And then you sort of need to wait until there are longer studies to see, okay, are these consistently appearing in folks? So and the trouble is a lot of these more unusual symptoms are in varying degrees of those stages where they're case reports, but we really need more controlled studies to really tell exactly what's happening. The problem also is with this current situation, you're limited in how well you can set up these studies because you're not going to say, oh, you're having all these problems with COVID-19. Would you like to participate in the study? And that's not the situation. So we're seeing science on the fly as a result too.
So what would be your advice to parents? You know, like for instance, especially in New York,
Yep.
if you have kids, like, and let's say they kind of lift some of the pause, or you know they're opening it up, how cautious would you be with advise parents with children? You know, summer camps. You know, should they start having play dates in the house or in their backyards? Is that safe? You know, what would you be saying parents should start looking at in terms of waiting for how long?
Yeah, so this is another example of where there was like some misleading information that's spread on social media and internet. You know, there's information suggesting, oh, kids aren't affected by this at all, so you know they can go about doing what they want. I mean, that was never the advice, that they can go about doing whatever they want, because even if they weren't affected, they interact with adults, so they can put adults in danger. So it's the same situation. You know, treat your kids like they were adults. So they should social distance as well. They shouldn't touch the same objects. They should wash their hands frequently. So if you feel that it will be tough for your kid to do that, then don't put them in the situation where they might do that inadvertently. So a lot of this is a reminder that, yeah, kids can be affected by it. You know, maybe the rates of more severe disease are higher in older individuals, but that doesn't mean that kids are completely resistant to any type of more severe issue or problem. And plus, we also have to remember the kids are going to interact with older adults themselves. Yeah. So same thing. I would avoid situations where they're interacting very closely. Keep them apart. Make sure they're washing their hands. Make sure everything that they're touching is disinfected.
You know, what about, it's interesting, I've heard people, even like in Florida, for instance, they've really raised things up, you know, in terms of going back to businesses, and people, women getting manicures, like last week. You know, what's your thoughts about that in terms of, you know, people doing those kinds of things? Do you think it's that it's following the recommendation, or you think that they're caving into what people want as opposed to what might be good for them, for us? You know?
Yeah, I remember, like, for instance, in Georgia, you know, they talk about opening massage parlors or things like that, or and I did comment in an article. It's like, well, okay, if you can find people with arms that are longer than 6 feet, but you know, that's going to be hard to find. You know, this has to be sequential. You know, there are essential services and there are things that you need to get done, and you know, there can be argument to get those things done. But you have to remember, there are things which may not be necessary, and you know, don't put yourself at risk or other people at risk to do something right now that's not necessary. I can't imagine some of these services doing it without touching folks or without getting close.
Right, you can't get a manicure without your fingers being touched. You
yeah, exactly.
Nature of manicures, even though there's protection, you know, supposedly plastic protections and masks, but you know,
unless they somehow put a file, I guess, at the end of a 10-foot pole, and you know, someone's doing this. You know, I just can't imagine that happening.
And for those of you that have not read any of Bruce Lee's articles, please read them. It's beautifully the way he's able to take extraordinarily serious information and just weave comedy and witty. It's just amazing. So if anybody wants to read it, I think it's they're on his website. They're also on the Mentor Project's website, and you can find it also on Forbes, right? In terms of on there, because everybody needs to read your articles. You know,
thanks, Susan.
Just email me. I will get it to you because they are amazing. You will really enjoy. I've enjoyed actually getting serious information, and I read it and I don't walk away so depressed. It's like it makes you laugh. So thank you, Bruce, for
well, thanks, Susan.
Us with that, because it's easy for us to digest very difficult information the way that you write. It's a great thing. Yeah, and everybody's agreeing. Everybody's in the chat is saying that's so true. Your articles are amazing. You know, read them. You will laugh and get smart. I love that line, Debbie. Love that line. There's your tagline. Read Bruce Lee. You will laugh and get smarter at the same time. Love it. Okay. Let's see how you can unmute yourself if you want to ask a question, and let us see you. Sam Stone does not want to be seen. How will we know when it's safe to be around others? What criteria is needed to be met from a health and science standpoint?
So again, we go back to the testing issue. So I would use the analogy, use the weather as an analogy. So, how do you decide when it's safe to go outside? You look at the weather report. You look at, okay, are there clouds around? Are there thunder? Is there thunder and lightning close by? Is it hailing outside? Similarly, we need some type of map to figure out where the virus is moving and who's getting infected where. And that's why we need broad testing. So if testing is only covering a small percentage of the population, then that's not enough to tell you. And I want to emphasize that, you see these numbers come out, like in terms of the absolute number of tests, that's not enough. Like knowing what the total number of tests that have occurred. Naturally, we have a very large country, so we're going to have more tests here than South Korea or than Germany or Iceland, for that matter. What we really need to know are multiple things. So one is we need to know the test coverage. What percentage of people have been tested? Demand fulfillment. What percentage of people who wanted tests or needed tests actually got the tests? And we need to know coverage geographically and by social demographics, et cetera. Once testing is widespread enough, then we'll be able to see, okay, the levels of the virus activity is much higher in these neighborhoods and much lower in other neighborhoods. And then that can allow more sequential or staggered reopening, right? So if you see that a certain place, like say you do a map and you see the virus is nowhere near like 50, 100, what have you, miles, then it's a lot safer to reopen something versus the virus is actively circulating in your neighborhood right then and there. And this is like beating the same drum over and over again, but without testing, we can't figure that out. We're flying blind. So if you look at, okay, so the countries that are cited as good examples in terms of what they've done, South Korea, Taiwan, Singapore are examples. Germany has done a good job as well. But you can see they never shut down. They never had as aggressive social distancing measures. They're playing baseball in South Korea and Taiwan. So if you look it up, you can actually see the games. In South Korea, they're playing baseball without the fans. In Taiwan, they actually have fans in the stands and they're separated. So that's an example of returning to, I don't want to say normal, but they're a lot more active. So that's what we need. We need those testing programs to be in place, and we need the contact tracing programs to be in place. So that's when we can actually start safely resuming different activities.
Thank you. Debbie, do you have a question? Or does Joel want to add a question or say something?
I actually have a question. Now, come wintertime, this is going to look a lot like the flu in some cases. And is that going to be an issue for us in determining, come fall, actually, when flu season starts to kick in, what's what? And how are we going to know, what we're really looking at? Or is there any advice that you have with regard to looking at this in that respect?
Yeah, so the question is how much seasonality does this virus have? And we know that a lot of other respiratory viruses like the flu do have seasonality. And one thing that's probably one of the things that may be driving the flu seasonality is humidity. So when the air is more humid, then the droplets in the air are bigger because there's more moisture, and that dilutes the virus and decreases the transmission. So that's one of the theories behind the spread of the flu virus. And the question is whether that actually applies to this coronavirus as well. So if that's the case, then the summer helps us because so transmission may go down, but we're not sure if that will happen. But on the flip side, things may pick up in the fall and the winter. So Debbie, your question is a very good and important question for several reasons. So one is, yes, people talk about an additional wave or things picking up come fall and the winter, but we also will have a tougher time distinguishing between this virus as well as the flu virus, as well as many other viruses. So there's the adenovirus, there's the parainfluenza viruses. So when we talk about flu-like syndrome, many people who get flu-like disease don't actually get the flu. They get other types of viruses because there's a number of different viruses that can cause flu-like symptoms. And so, so it could get confusing. If you have symptoms, you're like, do I have COVID-19 or do I have the flu? And then there was a study that was done in Stanford. Again, it was a quick study, so we have to has its caveats. But it found that the people who tested positive for COVID-19, there was a reasonable percentage, not the majority, but a reasonable percentage that actually tested positive for other viruses too. So that suggests that you may be co-infected possibly by two viruses at once. That makes things even more complicated. So we don't know exactly how often that might happen, but that can actually happen too. And then the question is, if you're actually co-infected, what does that mean in terms of the severity of disease? So we're in an interesting situation because, the peak of the flu season really occurred, back in January and February, and then things start coming down, whereas this was opposite, it started picking up in February. So we didn't really see that crossover. So that might be a new situation where we see that crossover. And remember, the flu and other diseases drive people to the emergency room as well. So then potentially the healthcare system could be overloaded. So these are all things that we really need to figure this out. We really need to push up healthcare capacity. We need to get ready for all of these things because, we shouldn't sit on the sidelines and just wait until what happens. We need to prepare right now.
Bruce, we have a question from Sharon.
Mm-hmm.
One great question, wondering how you feel about the Johns Hopkins Bloomberg certificate program for contact tracing.
Good question, Sharon. So this is connected with the New York contact tracing program, which is the most ambitious and comprehensive contact tracing program that's been initiated so far in the United States. So Bloomberg Philanthropies paired up with Vital Strategies, paired up with the New York State to initiate this contact tracing program, and they also connected with Johns Hopkins, which put together this online training program. And the program is good quality because it was put together by people who are in the know and who are experts, and then that program is going to be used to help train this army of contact tracers who then will be who will fan out in New York State and then do this test, trace, and isolate program. And I don't know if I completely clarified before what this means. Basically, you identify whoever might be infectious as quickly as possible, and then what you have to do is you go and interview that person. Like you put that person in isolation, but then you interview that person, and then you have to figure out whom that person came into effective contact with throughout his or her entire infectious period. Now that may sound straightforward, but it's actually quite complex. So imagine, I can't even remember what I ate during my last meal, or even like what I just ate maybe like a second ago. It's like, what did I just put in my mouth? Imagine trying to guess or figure out who you actually came into contact with, back until you started becoming infectious. So first you have to figure out when you became infectious, like when might you have contacted someone, got the infection, and then started becoming infectious. And you may not, you don't develop symptoms immediately many times. So the contact tracer has to be skilled at eliciting that information from you. So they have to ask the right questions. So you can imagine like, okay, Thursday, what did you do? Okay, I sat there, I went out to the market. Oh, you went out to the market. Who did you come in contact with? No one. Are you sure? You had to be at the cash register, right? Where there's, oh yeah, that's right. I was next to someone at the cash register. Okay, how close were you, etc. Okay, and who was that person? Oh, someone wearing a yellow hat. Okay, could you describe it more? So this can get quite complex. So the people who are trained to be contact tracers have to go through this training to really be able to elicit this information and use all these kind of tricks, these memory tricks, to try to trigger people's memory. And they have to be knowledgeable of what's an effective contact. An effective contact is a contact that occurs where you can potentially transmit the virus. So, seeing someone at the other side of a highway is not an effective contact. You wave to say, hey, that's not effective contact. But then you have to say, okay, running into someone nose to nose, that's an effective contact. So then you have to decide, okay, where do I draw the boundaries? And people many times don't remember, like 6 feet, like what if someone swung right by you, et cetera. So it's a lot of sleuthing. So that's why you need a good quality program to be able to train you to do that. So the Hopkins program is a good program to use to get that type of training. The other aspect of what you have to do is once you identify those infective contacts, you have to actually track them down. You have to figure out where they live. That sounds a little bit creepy, but like you have to actually track them down in a good way. And many people will think like, what are you trying to do? Who are you? Why are you trying to follow me and figure out where and you're telling me to go where, et cetera. You're telling me to go stick a Q-tip up my nose. So you have to be actually quite skilled in being able to put people at ease and just say, okay, no, I'm not trying to like stalk you. This is for good for public health reasons. No, we're not trying to like this is not part of some government conspiracy where we're trying to track you and hunt you down, things like that. So you have to actually be skilled at really talking to people, relating to people, et cetera. So there's a lot involved. So I think it's a good program, but beware about programs that aren't as well constructed, or programs where they there's going to be scams out there. So just be careful.
Of course. Thank you. That's really helpful. And I think it's also really fascinating for everyone, because I was like, should I ask this? It's more of a personal question. And I think what you said is definitely incredibly fascinating for everyone. So thank you.
Well, thanks for your question.
Thanks, Susan. Oh, is Susan frozen?
I think Susan might be frozen.
Yes.
I think Susan is frozen. I want to thank you, Bruce, for coming on tonight. This has been amazing. Do we have any other questions for Bruce while Susan is taking a break?
Defrosting.
Yes, exactly. Okay.
Could I have a question?
Sure.
Susan Jaquet. Hello, everybody.
Hi, Susan.
Hi, Susan.
Hello, Bruce. So we hear a lot about the high-risk category over 60, and I qualify, and my husband largely qualifies. Although people are now saying, well, it could be 50 or 40. I mean, everybody's kind of at risk. But like my husband has diabetes, so that's definitely an underlying illness or concern. But what about like, is an underlying illness something like that you had a long time ago? I'm just curious, like I had breast cancer 20 years ago. Knock on wood, so far so good. I'm just curious, is that like anybody who hasn't had perfect health for the last 20 years, does that lump us all into the like be really careful category?
So the rationale is that if there's anything that may compromise your immune system, if your immune system is weaker for any reason, then you may be more susceptible to the infection and also more serious consequences with the infection. So we do know that when people are first born, your immune system is still learning, so it's weaker then. So there's many situations where, babies may be more susceptible to infections. I mean, that hasn't been proven with the COVID-19 coronavirus. And also, as you get older, you get to a point where your immune system does get weaker. So that's why there's the age recommendation. But it's not like a cutoff. It's not like you have a birthday and suddenly like things change. We all know that it's gradual. So when they set these age limits, that's more as sort of like general trends with the population. So I wouldn't set that as a serious cutoff. And of course, if you have an active chronic medical condition like diabetes or cancer or something of that sort, or you're on a medication like steroids or some type of medication that will suppress your immune system. If you've had a condition in the past and you're fully recovered and presumably your immune system has picked back up again, then that shouldn't be a risk. Now, of course, when people have some conditions in the past, their immune system may not completely recover. So you can get idea, like, you can also look at, are you getting sick more often? Are you getting respiratory illnesses more often? And how's your health in general? So that's the way you sort of evaluate if you're talking about something that's happened in the past and that you've recovered from.
I see.
Yep.
Thank you.
Mhm.
Well, we're sheltering in place anyway, and as far as work, just once in a while I have to put on my mask and gloves and booties and go show a house for real estate. But we're staying home. We're getting deliveries, and so that was a wonderful presentation. Thank you so much for all of the information and sharing your expertise with us.
Well, thank you, Susan.
Mm-hmm.
Joel, thank you, Susan. Joel, did you want to add the one thing?
I did have one question, as long as I'm getting free medical advice.
Sorry.
And that is, I had, and other people have had surgery. So I've had complete shoulder replacement surgery. And now I'm told I have to take antibiotics when I go to the dentist. Does that mean I have a compromised immune system?
You have to take antibiotics when you go to the dentist?
Yes, they told me that when they do a cleaning and the blood, potentially goes in there, that because I don't have a normal shoulder, I have all these appliances in there, that an infection can find its way in there.
Okay, so yeah, the key thing there is you have some type of implant or appliance, et cetera, and those tend to be, because whenever you have something placed inside the body, some type of equipment, it's not the same as natural body parts. So your natural body parts have their own defense mechanisms that can help resist infection. But when you put a piece of metal or something like that, it doesn't have the same thing. So it's a higher risk for being a place where bacteria can grow. So that's probably not why, that alone is probably not causing a suppression of your immune system. But the general recommendation is that when there's some type of appliance there, that you may be at higher risk for bacteria traveling to that location and then creating an infection. So, of course, without knowing the full medical history, I want to put that disclaimer, without knowing the full medical history, that's a likely reason, and it's not because of a suppressed immune system.
Okay, thank you.
There's always that qualifier, like, this television show does not constitute formal medical advice, or, they say on Twitter, just et cetera. So I guess I have to throw that.
No, whenever I do
disclaimer
research, I go P less than 0.05 means that it's a 1 in 20 chance that it's an accident. So,
Bruce, you have been so generous with your time tonight. Oh my goodness, this has been absolutely fabulous. Thank you so much, really. This has been great. Yeah, and we're going to need continuous updates. We'll make it shorter, but we'll talk about getting people to give you. Neil, did you have a question? Hi, Neil. No, you're just showing that you're here and saying.
I'm just showing that I'm here. That's all.
So good to see you, and we hope to see you in the future too. So
Thank you.
See you, Neil. And any last questions? Thank you, Joel. You make my day. I can't have one of these shows without having one thing from Joel, so thank you.
okay, so we're done. I can go then.
Go now. You go. So anybody else, just last chance? Well, just for tonight, but he'll be back. I know he'll be back. Anybody else? Tom, I see you talking, but you're muted.
Hold on.
Just saying thanks again.
Okay. Yeah, so this has been absolutely wonderful. Thank you so much. Really, you just were so generous, and you really gave us a lot of information. If you want to find Bruce, you know where to reach him. You can get him at the Mentor Project. And as I always do, I just want to thank the Mentor Project so much. If you want to support the Mentor Project, we're really looking to actually, it's been wonderful because the Mentor Project has grown so much, and we have so many wonderful mentors that we're looking, I know they want to really upgrade their website so that you can do searches. So if you know of anyone that is interested in either volunteering their time if they're a specialist, or anybody that can contribute to the Mentor Project, please go mentorproject.org check the Mentor Project out. You can also see great hour-long conversations with mentors, as well as listen to podcasts. And if you have any further questions, please go there and ask. And again, please contribute. Thank you so much. And this has been great. And it's great to see all of you. Great questions. Have a healthy and happy week. And I'll see you Wednesday and maybe even Friday. So thank you. Thanks, Marie. Marie said thank you for a great presentation. And thanks again, Debbie. And again, thank you so much, Bruce. Thank you. And elbow and bow and everything to you.
And shimmy, right?
Yeah, the shimmy, of course, we can't forget the shimmy.
Yes.
Great. Thanks again.
All right. Thank you.